Welcome to another Pharmacy Pearl by PACU. Atorvastatin, a commonly used statin, is often administered to patients with ST segment elevation myocardial infarction to improve outcomes. This synthesis examines the efficacy of early administration of atorvastatin in the emergency department for STEMI patients, particularly focusing on its impact when given before percutaneous coronary intervention. Let's discuss the pharmacology of atorvastatin. The recommended dose for patients with STEMI is 80 milligrams orally once daily, and its pharmacokinetic profile shows an onset of 3 to 5 days for LDL reduction, with peak effects seen in 2 to 4 weeks. Common adverse effects include myopathy, elevated liver enzymes, and gastrointestinal symptoms. Atorvastatin interacts with CYP3A4 inhibitors and inducers, so it's important to monitor for these interactions and avoid use in patients with active liver disease. Generally, atorvastatin is compatible with most cardiovascular drugs. For rosuvastatin, another high-intensity statin option for STEMI patients, the recommended dose is 40 milligrams orally once daily. Like atorvastatin, rosuvastatin has an onset of 3 to 5 days for LDL reduction, with peak effects in 2 to 4 weeks. It also shares similar adverse effects, including myopathy and elevated liver enzymes. However, rosuvastatin has minimal CYP interactions, making it a suitable alternative for patients on multiple medications. It's generally well tolerated and is compatible with most cardiovascular drugs. Let's move to the evidences. Here are the key studies examining the efficacy of early administration of atorvastatin in STEMI patients. Schwartz and colleagues conducted a randomized controlled trial with 3,086 participants in 2001. Atorvastatin, 80 milligrams per day, versus placebo-initiated 24 to 96 hours after acute coronary syndrome, showed a reduction in recurrent symptomatic ischemia, requiring rehospitalization. Lee and colleagues conducted a randomized controlled trial in 2012 with 161 patients, finding that high-dose atorvastatin, 80 milligrams, significantly reduced the incidence of contrast-induced nephropathy, 2.6% versus 15.7% with p-value of 0.01 in STEMI patients undergoing PCI. Liu's 2013 randomized controlled trial with 102 patients demonstrated that a loading dose of atorvastatin 80 milligrams before PCI significantly reduced inflammatory markers and improved cardiac function, p-value less than 0.05. Zhu and colleagues in a 2016 randomized controlled trial with 120 patients showed that intensive atorvastatin 40 milligrams significantly improved endothelial function and platelet inhibition compared to standard atorvastatin 20 milligrams, p-value less than 0.05. Kim's 2015 study with 67 patients found no significant reduction in myocardial damage, but high-dose atorvastatin pretreatment was safe and well tolerated. Gavazzoni conducted a study in 2017 with 52 patients, finding that high-dose atorvastatin improved endothelial function and reduced inflammatory markers, p-value less than 0.05. Liu, in a 2013 study with 102 patients, demonstrated that a loading dose of atorvastatin before PCI improved left ventricular ejection fraction and reduced inflammatory markers, p-value less than 0.05. Adele's 2022 study with 99 patients compared high-dose rosuvastatin, 40 milligrams, to high-dose atorvastatin, 80 milligrams, and found that atorvastatin had better outcomes in terms of coronary blood flow and myocardial perfusion, p-value less than 0.01. Finally, Chen's 2022 study with 98 patients found that enhanced dose of atorvastatin improved cardiac output, left ventricular ejection fraction, and reduced the incidence of major adverse cardiac events, p-value less than 0.05. Early administration of high dose of atorvastatin in the emergency department for STEMI patients undergoing PCI appears to offer several benefits, including improved microvascular myocardial perfusion, reduced inflammation, and protection against contrast-induced nephropathy. While it does not significantly reduce infarct size, it enhances endothelial function and is generally safe and well tolerated. These findings support the use of high-dose atorvastatin as a beneficial pre-PCI treatment in STEMI patients. For more details about these studies, click the link below. And for more concise pearls like this, visit our PACU website or follow our social media pages.